Assalamu alaikum. Now, it's a different sort of topics known as bind. That means bilirubin induced neurologic dysfunction. What's this pathophysiology? Excess free unconjugated bilirubin unconjugated is water insoluble. Unconjugated is water insoluble, and it crosses the blood-brain barrier. Unconjugated bilirubin crosses the blood-brain barrier. If there is excess free unconjugated bilirubin crosses the blood-brain barrier, it deposits within the basal ganglia and the brainstem nuclei and causing neurological damage, necrosis, and atrophy. This is the pathophysiology of bind. Excess free unconjugated bilirubin crossing the blood-brain barrier, depositing in the brainstem and the basal ganglia and causing neuronal damage, necrosis, and atrophy. What's this risk factor? Risk factor is prematurity. Risk factor is prematurity. Prematurity, hemolysis, G6PD deficiency, glucose 6 phosphate dehydrogenase deficiency. In glucose 6 phosphate dehydrogenase deficiency, you get the Hinge body. There is hemolysis, hemolytic anemia, presence of Hinge bodies, and there may be birth trauma like cephal hematoma. And this type of cephal hematoma happens during forceps or vacuum assisted delivery. This sort of cephal hematoma happens, and these may cause bind. Exclusive breastfeeding with excessive weight loss. Exclusive breastfeeding with excessive weight loss can cause bind. And with or without reversible treatment, phototherapy, exchange transfusion. These are the treatment options you need. It is uh, usually reversible if it deposition is more and there is more neurological damage, more neuronal damage, more necrosis. It may cause as far loss or atrophy of the brain, and then it may be irreversible. Acute encephalopathy and chronic encephalopathy. In acute encephalopathy, what you will get lethargy or inconsolability, hypotonia in early case, and hypertonia in late case, apnea or respiratory failure or feeding difficulty or seizures. Acute encephalopathy in chronic encephalopathy, it is irreversible, and the clinical conditions and the clinical findings is a developmental delay, sensorineural hearing loss, chorioathetotic movement, and upward gaze palsy. So from above, developmental delay, eye, upward gaze palsy, here sensorineural hearing loss, and chorioathetotic movement. And that's all about bind. Hope you enjoyed.